So what does the evidence say? So let's start talking about the tip of supplementing vitamin D and preventing bone density problems. Supplementing vitamin D is the most studied with its own independent systematic reviews and meta-analyses and one large-scale randomized control trial where they taken people that's been supplemented with vitamin D compared to a group that has not. Now, we view systematic reviews and meta-analyses as very high levels of evidence because these basically take a large number of studies and are able to pull together a lot of individuals and to be able to gather a lot of statistical data about a particular topic. So, and they can add a lot of validity to the findings. So let's get into these a little bit. 2 recent peer-reviewed studies were published both as systematic reviews and meta-analyses. One was published in 2021 in the Journal of Science Progress and another in 2022 in the Journal of Neurology. And those determined that treating people who have low vitamin D significantly reduces the risk of their BPPV from returning compared to people who have not been treated for their vitamin D deficiencies. Now, these studies come from very high levels of evidence, reviewing other studies, and then combining them into a larger statistical pool of data. So it must be noted that each of these meta-analyses use mostly control trials that were not randomized in case series studies to pool the data together, but did include one major randomized control trial in the Journal of Neurology in 2020 with over 1,000 subjects, which they followed over a year. So they treated over 1,000 patients with BPPV successfully across 8 hospitals, and basically half of the people received the supplementation of vitamin D and along with calcium, and then the other group did not receive anything. And then the researchers followed up with them a year later. So this study showed a significant difference in the group that was treated with the vitamin D and the calcium. Now, these findings have been supported by several review studies which looked at the risk factors of recurring BPPV. And so the most was this systematic review and meta-analysis from 2021 published in the Journal of Neurology, which analyzed over 3,000 patients with both prospective and retrospective studies. And what they found was that vitamin D deficiency was a significant risk factor for recurring BPPV. Osteoporosis was also one of those risk factors, which fits the overall bone health theme of positional vertigo coming back.